Good evening. My name is Joanne Boyd, and I am the president-elect for Pittsburgh Black Nurses in Action. And on behalf of Dr. Lisa Isaac, the president for Gateway Medical Society, I'd like to welcome you tonight to our fourth series in dementia caregiving, educational tips for the caregiver. Just a little bit about Gateway Medical Society. It is an organization that was organized in 1963, and it is a component of the National Medical Association. The National Medical Association's objectives are to promote science and the art of medicine for the betterment of public health. So tonight we have a dynamic panel again, and we are also very pleased to welcome Monica Lockett, who's going to be our moderator facilitator for tonight's presentation. Monica is the Executive Director for Healthcare Services for Longwood at Oakwood, a continuing care retirement community. She has served in this nursing home administrative role for the past 7 years, providing leadership for their 60-room facility. She is a graduate of West Virginia University School of Journalism and also holds a master's in healthcare administration from Marshall University. She's also a certified dementia practitioner. Monica is also a Paul Harris Service Award recipient and supports Rotary and Compassion International. She is an active member of Petro International Ministries. Please join me in welcoming Monica as she will take over now and facilitate our evening.
Wonderful. Thank you so much, Joanne. I'm very pleased to be here with you all this evening for this, what is the fourth education session of a 6-series event. And so tonight I have the pleasure of introducing our 2 speakers. I also have the pleasure of working with those 2 speakers at Presbyterian Senior Care Network. And so I'm very excited to have to be here with both of them. I know you're going to learn a lot. Amy Kowinski, she's a registered dietitian and a certified dementia practitioner, and also the executive director of Dementia 360, which is a program that supports family caregivers of people that are living with dementia. And how she ended up in this role, she's always worked in healthcare and in gerontology, dementia, education, nutrition, and has worked in interdisciplinary teams helping people as they are going through their journey. So you're not only going to get her professional experience, but you're also going to get a little bit of personal experience. And I think this is how she ended up where she is currently. She watched her mom take care of her grandmother, who was living with dementia and trying to have a career and take care of a family, and recognize that there just are not that many resources out there for dementia care. And as a result, she kind of shifted gears with her career and wanted to become more of an expert with dementia and be able to help others as they progress through their journey. In addition to our Amy, we also have Stacy Stull. And Stacy is retired from her 30-year career in medical and behavioral health research. She reached out to Dementia 360 after having her own personal experience as well. She watched her mother, when she was in college, her mother took in her grandmother and was taking care of her grandmother who was living with dementia, and her mother was trying to take care of her family and do all of those things. And then Stacy found herself taking care of her mom, who was living with dementia. And so now she gets to take her career from retirement and turn that into a new passion and a mission where she can apply her experience as a researcher and educator, continue her own learning, and satisfy her desire to help others. So this evening, as we get started, I want to remind you that we are recording this session, and you will be able to see this recording at a later time to pick up on those tips that maybe you want to hear again. And we encourage you during this session to please add your questions to the chat. Stacy and Amy are going to leave enough time toward the end of the presentation to answer your questions. So please add your questions to the chat and we will have those questions asked at the end. So without further ado, I'm going to present to you Amy Kowinski. Thank you, everyone.
Thank you, Monica. I'm actually going to go first tonight.
I'm sorry. Thanks,
No,
Stacey.
it's okay. It's okay. I know we switch back and forth and confuse ourselves. So thank you. And thank you for having us this evening. We really appreciate Gateway Medical Society and Pittsburgh Black Nurses in Action for inviting us here to speak tonight. We're happy to be here with you. This series has been created especially for family caregivers of people living with dementia, because we know that life does not prepare anyone to be a dementia family caregiver. So we're here to help you with that. This series is made up of 6 presentations to help you learn more about dementia and how to make your caregiving journey a little easier. We will also have the opportunity to call in for one-on-one coaching sessions to work on specific challenges that you're dealing with at home. We have found that this combination of teaching and one-on-one coaching works really well for families, and we hope that it works really well for you. Next slide. Oops, I'm sorry, you're already on the next slide. There, let me catch up with you. So this is a list of all of our talks that we're going to give, the educational series. And it's a 6-part series that we put together specifically for dementia caregivers. The presentations will be every other Wednesday evening from 7 to 8 p.m. Each session is on a different topic, and the entire series contains what we consider to be the most important information for you as a caregiver to know. We hope that you'll be able to register and attend all of the sessions. Okay, you could change the slide, Aim. Thank you. The previous webinars in this series will be available by going to the Gateway Medical Society website listed here, www.gatewaymedicalsociety.org/. If you click on the News and Events tab and then select the latest news from the drop-down menu, then look for the box that's pictured below and click on the hyperlink titled Gateway Medical Society Virtual Recordings. And then you should be able to listen to all the previous recordings of the sessions that you might have missed. All right, change the slide, please. Okay, and on the off weeks in between the presentations, we'll be offering 30-minute telephone coaching sessions on Wednesdays from 7 a.m. to 5 p.m. And the dates and the phone numbers are listed here on this slide. So the webinars will help you get the educational information that you need to know. Then you can use the coaching sessions to talk with one of our dementia experts on how to apply what you're learning at home to overcome some of those challenges and make the days better. Please change the slide. We also wanted to tell you that we'll be mailing you a workbook that gives you information from the 6 sessions, because we hope this information will be able to come in handy for you in the future. We also want to learn from you, the caregivers, about what you're experiencing, whether this series is helpful to you. To do this, we'd like to ask you to fill out a short survey if you haven't done this already. Some people have, at the start of the series and then again at the end of the 12 weeks. And this will ask you a few questions about your caregiving journey and this series. If you'd like to be entered into a raffle for a Target gift card, please put your name and your phone number into the survey so we can contact you if you win. We'll put a link to the survey in the chat at the end of the webinar, so that, and we'll also mail you a copy of it with the workbook that we're sending out to you. Now, let's find out what you can do about behavioral symptoms in dementia. I don't know if you've felt like this, but I know I have at some points in time. So why does this matter? about these behavioral symptoms. Most people will experience at least one behavioral symptom as they go through their dementia journey. They look different for everyone, though. The most common stereotype symptom of dementia is agitation or aggression, but this doesn't happen to everyone. We're also talking about things like repetitive questions, shadowing, following you around, apathy, hallucinations, hiding things, being paranoid, and so many others that I'm sure that you've experienced, one or two not on this list. What are you experiencing in your household with your family member who's going through this? Don't compare their journey to someone else's, because the behaviors are also often the most stressful part of the caregiving and have some negative effects, including stress for both you and for your family member, tension in your relationship, which can lead to care challenges, the refusal to bathe, refusal to take medicine, that don't you tell me what to do, health problems when someone is refusing care to do things that are important for their health and well-being, and eventually, because of the stress, caregivers just throwing up their hands and saying, I can't do this anymore. And we don't want to get to that point in time. So could you change the slide, Amy? We want to talk about a new way of thinking. If you use these 1 and 2 to help you start looking at things just a little bit differently. Why? Because you can see most of the time these occur as a response or reaction to something else. We want to use the word distressed reaction instead of the word behavior. This is really good news for you. If you can change what they are reacting to, you can possibly prevent that reaction. But just to warn you, this will take some practice. It's a challenge to be able to think about these things in the moment and take action. But give it a try. Thanks. You could change the slide. So we want to give you a new way to think about the things that you see when you see these distressed reactions. It's usually one of 3 things, and it's your job to figure out which one is causing them to get upset. First, do they have an unmet need that they're having trouble expressing? Second, is something in the environment around them causing them to react? And finally, could they be reacting to something about you or your approach in this situation? We're going to break down each one of these now. Amy, could you change the slide? First, let's talk about unmet needs. Sometimes as dementia progresses, the person may have a need and either not be aware of it or not be able to tell you that you have it. Even if you ask them, they're not able to communicate that to you. First, could they be in pain? If they've had arthritis for years and used to take medicine for it, and since they've had dementia, they don't really take medicine for it anymore. This doesn't mean they don't have the pain. They probably do. And if you say, Mom, are you in pain? Remember, 7 out of 10 times, a person with dementia will answer a no to a yes/no question. So it's the same with hunger or thirst. If you ask, are you hungry or thirsty? They may say no, but you know them and you know their habits better than anyone else. And so, has it been a while since they've had something to eat or drink? These are all things to keep in mind. Could they be bored? Again, they're probably not going to tell you they're bored, but if you see them pacing or getting into things or generally getting restless, it's a good sign that they need something to do. Like we talked about last time on our last presentation, boredom can be a huge trigger for behaviors. Remember what we said. If you want someone with dementia not to do something, you have to give them something else to do. Could it be that they're overtired? They may not be able to tell you, but if you know that they had a bad sleep night last night, they might be. Think of how you feel when you don't get enough rest. Do they need to use the bathroom? This one may sound strange, that needing to use the bathroom could trigger reaction, but it's true. I worked with a family where she would get up in the middle of the afternoon from the couch and start doing what they call dancing around the room. They thought she was bored, but when you looked closer, she was actually holding her pants and she needed to use the bathroom. She was trying to tell us without being able to communicate that in words. Finally, do they need security or love or reassurance from you? When they look at you, do they feel like you're someone who loves them, or are you someone that sometimes makes them feel bad? So these are some of the things you need to keep in mind about their unmet needs. You may remember this slide from our last presentation, or our fundamentals presentation, that talks about emotional needs. People with and without dementia have basic foundational needs that need met. They need to be needed, to be loved, to care, to be useful, to be able to make choices, and to have self-esteem. If you see a distressed reaction, it could be because one of these emotional needs was hurt or not met. Emotional needs are no different. Our needs do not change throughout our lives, even when we're living with dementia. Could their self-esteem have been hurt? Were they trying to be helpful? Were they trying to be useful? And they felt that this was thwarted. So keep those in mind as well. Next slide, Amy, thanks. Now let's talk about the environment. Could they be reacting to a noisy environment? Dementia affects their ability to process and to focus. Noise also affects their ability to process and focus. Put both of those things together and a reaction could easily be triggered. One woman noticed how her husband would start to get angry and frustrated every time she would be in the kitchen cooking dinner. She finally realized that the sounds of the pots and pans were too much for him. Did she stop cooking dinner? Of course not. But what she did is she made sure that he was in another room with some headphones on, listening to some quiet music that he liked during that time. We knew another person who realized her brother would get really upset every time she would run the vacuum. It was too much for him to process. Did she quit vacuuming? No. She made sure she vacuumed when he wasn't around. Is it too hot or too cold in the room? Could they be reacting to that temperature? Do they tend to be cold often? If that's the case, turn up the temperature a bit or offer a sweater or a blanket. Could the alternative be true? Could they be too warm? This is also cause for a reaction. They may not be able to tell you, but if you see signs like that they're sweating or they just showing other signs of being too warm, you could try helping them switch to lighter clothing or turn down the thermostat, and then you could put on a sweater. Is the environment scary for them or unfamiliar? Are they not recognizing where they are right now and wanting to go home? This is where some love and your presence and reassurance will go a long way. And finally, is the environment confusing? Are there a lot of flashing lights or different noises? Are a lot of people in the area, in the room, talking at one time? The TV is too loud. They can't keep up or they can't focus on things. So that can be very disturbing. So we can't change how they process the incoming information, but we can change the environment to make it friendlier to them when we know that they are having trouble processing. And then let's take some time on this next slide. when you see a distressed reaction, could they be reacting to the way that you are making them feel? Relationship troubles are probably the #1 reason we see people with dementia experiencing distressed reactions. So it's really worth thinking about. We said in the communication talk, but it bears repeating, when you talk to them, if you look in the mirror and you look like your mother on a bad day, you need to dial it back and start all over. Are you stressed? Remember, they're going to mirror your emotions. If you're stressed, they will react to that. Could they be getting the feeling that you're bossing them around? Sometimes we don't even recognize when we're doing that. That never goes over well. If you know that they're feeling like they're being bossed around is a trigger, you can't change their reaction, but you can change your approach. Try and be more gentle with them when you're asking them to do certain things. You can see that this all goes back to communication and how you make them feel when you're talking with them. They are forgetting the facts, but they're not forgetting how you make them feel. Are you paying attention? I mean, really paying attention? You know, you can tell when you're having a conversation with someone and they're not really listening, they're just kind of phoning it in. And you know how that gets very frustrating when you're trying to, you know, how often people are multitasking when you're with them. And if you're not being able to give your family member your full attention, they will know, and they may react negatively to that. Finally, are they getting the feeling that you're rushing them? That can often be a trigger a reaction too. If you know that it's a hot spot for them, what can you do to change that so that they don't feel so rushed? Could you schedule that doctor's appointment for later in the afternoon? Or could you show up a little bit extra early so that they have enough time, you have enough time to help them get ready without rushing them along? These are some of the ideas to keep in mind when you are witnessing those distressed reactions. And Amy is going to come on now and put it all together for you, and she'll give you a few scenarios that will be very helpful in the future. Thanks.
Thanks, Stacy. So yes, let's put it all together. So next time you see a behavior, number one, try not to think about it just as a behavior. Think of it as a reaction to something else. So next time you see that happen, ask yourself, what could my family member possibly be reacting to? And so once you know what they're reacting to, once you know what the trigger is, you can change it for the next time with the goal of being able to change their reaction. And you can, in many instances, be able to decrease the chances that it will happen again, or at least be able to decrease the extent or the intensity to which it happens. And, you know, like Stacy said, it can be difficult, but, you know, as you practice this and as you really start to think about these scenarios that you go through with your family member, you can find some clues. So, you know, for example, if there is say a grandmother is at a family get together with her kids and her grandkids and her great grandkids, she usually loves family, but all of a sudden she gets up and she wants to leave. And you think, well, why is that? Grandma, you love this. Think, could she possibly be reacting to the noise level in the room? Or if your mother seems angry and confrontational, take an extra second to look in the mirror. Is it possible that you look angry and confrontational? Like Stacy said, she will mirror your reactions. But now let's go through a couple of practice examples. So the first one is you tell your husband to get dressed because it's time to leave. He goes back to the bedroom and gets dressed, but when he comes out, he's frustrated and angry. So what could have caused this distressed reaction? So let's break this down and see if we can look at it from some different angles. So like Stacy said, we'll look at your approach, We'll look at unmet needs that he might have, and we'll look at sort of the environment or the world around him to see what could be causing this. So first, let's talk about your approach. When you told him to go get dressed, could he have felt like you were maybe bossing him around? Or, it was mentioned in the sentence that you tell him it's time to leave. Could you possibly have been running late, and so you were feeling a little hurried, and so he feels like he's actually being rushed by you? That could trigger a reaction. Second, think about unmet needs. Could he be tired? When you think about it, for whatever you're going out for, is this the time of day where he's usually at his best? Or is this a time of day that he's at less than his best? And what could you do if that is the case? Third, let's think about the world around him. So first, you told him to go get dressed. At that moment, does he remember where his clothes are or where the bedroom is? If he gets back to his bedroom, does he know which drawer his pants are in or where to go to get the shirt that he needs to wear? Or is the task of actually getting dressed getting really difficult? Is it hard for him, or is fine motor things getting more difficult for him, and it's actually hard for him to button the buttons, and he's getting frustrated by that, and so he comes out angry because he's so frustrated that he couldn't do that? See how you have to figure out which part is really causing him to get frustrated and angry to really be able to solve it. If you decide in this scenario, well, maybe I need to change my approach, and you change your approach and he comes out frustrated and angry because in fact, he can't find his clothes or he can't figure out how to, button up his shirt. You tried one approach, but you need to really zero in on what was the trigger, what is the thing that he was reacting to, and then you can help to minimize that reaction in the future. Okay, we'll do another one. So your wife is very calm and watches TV for most of the day, and then every evening she starts packing her things and saying she's moving home to her mother. You tell her to please sit down and remind her that she lives here and that mom is dead, but she seems not to get it. So what could she be reacting to in that situation? So what in your approach could be causing that? So I'm guessing that she might not like it when you tell her to sit down, because no one likes to be told what to do. And I'm also probably going to guess that if she believes that this isn't her home and she believes that her mother is alive, that she's not going to appreciate that or receive that very well when you're telling her something that contradicts what she knows to be true. Let's think about unmet needs. I think a big one here, since she was very calm and watches TV for most of the day, she's probably bored from not doing very much all day. Chances are she was probably not watching TV because that's what she chose to do. Chances are she was watching TV because she didn't know what else she could do. And now it's the end of the day and she's got a bunch of extra energy that she needs to burn off. And you as the caregiver are tired. That is the perfect storm. Third, what about the environment could actually be making her want to leave? So we know that some people with dementia do tend to get scared at night, particularly, in Pittsburgh winters when it's dark at 4 o'clock in the afternoon, the rooms get kind of like dimly lit and shadowy. And so it's hard to tell, what is a person and what is not a person. Person may or may not be able to recognize themselves in the mirror at that point. I mean, that could be really scary if you believe that there's someone there with you and you don't know who they are. So, another thing that we often see that causes people to have distress reaction is too much news. Doesn't the news scare you sometimes? So actually it can be beneficial sometimes, especially during that wind down period in the evening, to turn the news off. and watch something calm and peaceful. And finally, it's important to know that most of the time when people are saying, I want to go home or I want my mom, that they're not necessarily meaning their literal home or their literal mother. Instead, what they are asking for is the security and comfort when you think of your childhood home or when you think of the comfort your mother provided. So they're looking for security and comfort because something in the environment is making them uncomfortable. So you can figure out what that is. You can probably keep her calm and more peaceful in the evening. Okay, and this is a big one here. We talk about this with families all the time. So you show up for your moms at 11 a.m. and tell her it's time for her to take a bath. Like usual, she says, I already took one. So you argue about that for a while, and she tells you not to tell her what to do. You try to help her take her nightgown off, and all of a sudden she has her fist clenched and looks like she is about to hit you. And so you give up. So this one could go a lot of different ways. We don't even have time to dissect this one to the extent that we actually could. But we'll go through a few possibilities here. So again, we'll talk about your approach. When you show up and you say, it's time to take a bath, and you tell her that no, she didn't already take a bath, and you start arguing, what sort of vibe are you giving off there? What does your face look like in the midst of that argument? What does your posture look like? Are your arms folded? You look angry? My mother used to get this like wrinkle in between her eyebrows. We could always tell when she was angry at us. Do you have that too? Second, let's talk about her unmet needs here. Sometimes, there can be aspects actually to the shower experience itself that become scary or unpleasant. For example, sometimes people get sort of hypersensitive to different feelings. And so even the rush of the shower water, like pelting a person, can feel very painful to them. If I thought that a shower was painful, it probably wouldn't make me want to take one very often. And that's what those handheld shower nozzles can be great for in that case, to give someone more control over where and how it's hitting them. Or does she get soap in her eyes because she can't put her head back anymore and that burns? Or is she afraid of falling because the floor is really slippery or she can't navigate the bathroom herself? All of those things, like fear, can lead, and pain can leave a painful or emotional memory and really make a person not want to take a shower. But again, the good news is all of those things can actually be addressed. Third, let's think about things in the world around her. So first, let's think about the routine that she's used to. So if she gets up at 7, for example, and you don't come over until 11, and she's always been a morning shower person for her life, for most of her life, of course she's going to think, I already took a shower. I've been up for 4 hours. And think of the routine itself of taking a shower. So, we tend to take for granted that there are many, many steps involved in taking a shower that she could have the potential to get really mixed up on. So for example, what's the hot water and what's the cold water? With all of these products in the shower, what's the shampoo versus what is your shaving cream? Or how do I get the soap on the washcloth? And what are all the parts of my body that I need to wash? I mean, this gets really complicated for somebody living with dementia. And finally, let's think about that part where you try to take her nightgown off and she reacts to that. So she could be reacting to a few things there. I mean, maybe the bathroom is too cold. And so maybe she would benefit if you went in there ahead of time and got it all warmed up and maybe threw the towels into the dryer so you could drape a warm towel around her. Or maybe, more serious than that, maybe at that moment, she's not recognizing you as her daughter. So, who wants to take their clothes off in front of a total stranger? That's not something that we typically do. So you could always try keeping her covered with a towel or a robe, so that she feels, like her dignity is being preserved. So again, we could talk about bath and shower issues all night. The point of all of this, though, is in this case, you need to figure out, what is the real reason, what is the most significant reason or reasons where she doesn't want to take a bath or a shower, or, more general than that, what is the reason that she is having a distress reaction or a reaction of some sort. If you can think about what she is reacting to, you can change it for the next time. So yes, the two takeaways when it comes to behaviors or distress reactions, you can't change the reaction. You can't change the reaction, but you can change the things that caused it. And so the ability to change or minimize distress reactions is built on developing good communication and interaction skills with the person with dementia, building a dementia-friendly environment, and looking for unmet needs that might be causing that reaction. But what do you do if you are doing all of these things and they end up having a distress reaction anyway? I mean, sometimes we are doing the best that we can, and maybe they are just having an off day. We all have off days sometimes. That is okay. But in the middle of it, number one, find ways to agree with them. Don't disagree. Don't argue. At this point, if you're in the middle of a reaction, everything that you want to do needs to be about just like decreasing that, taking the intensity away. So agree, say, you're right. I'm sorry. Even if they're not right, it's okay. Take a breath and take control over your nonverbals, your face, your tone, your posture. And ultimately, as we know, many of these behaviors or distress reactions are often caused when a caregiver is trying to get the person with dementia to do something like a care task. So at that point, if they're having a reaction, I just want to say, just back off the task. It's not going to hurt if they can't get a shower until later. It's not going to hurt if they can't brush their teeth until later on. It's okay. Give them some personal space. You may actually need to get out of their line of sight for a little bit. It's okay to walk into another room. And then a little bit later, give them some time by themselves and then walk back in and start all over. Don't bring up what happened. They probably forgot. Unfortunately, you remember, but they probably don't. And start over again. Speak as calmly as you possibly can through all of this. It can be helpful, as hard as it is, to remind yourself that they're not acting this way on purpose. It is because they have a brain disease. And then, a very powerful tool is to distract them by giving them something else to think about. We talked earlier, Stacy said, if you want someone with dementia not to do something, you have to give them something else to do. That also goes for thinking. If you want someone with dementia not to think about something, you have to sort of break that thought cycle and give them something else to think about. And some people say, well, wouldn't medicine be easier? So, what I do want to say is that ultimately a pill does not stop a behavior. It would be wonderful if it did. A pill does not stop a behavior. So truly, the first line strategies for reducing the behavioral symptoms should always be changing your approach and changing the environment around them. You have to be able to change what it is that they are reacting to. And medications that are sometimes prescribed can have very serious side effects to people with dementia. I mean, they can increase a person's risk for falling, they can increase confusion, they can increase kind of sleepiness or alertness, they can increase confusion, and they can actually also increase a person's risk of death. So, you know, there are instances where medications should be considered. So when might it be time to talk to the doctor about a medication and whether one might be right for your family member? So we usually say if your family member is in danger of harming themselves or other people, it might be wise to have a conversation with the doctor about that. And you know, when you've done all of these things, when you have consistently changed your approach and you have consistently tried to make the environment as friendly to them as possible, but it's not helping, at that point, you might want to talk to the doctor. And so, you know, also it is worth saying, you know, even if they are on a medicine for a behavior, that the medication may lessen the intensity of it, but it is still equally as important to continue to work on your approach and to creating a dementia-friendly environment. And so it is almost time for questions, but before we do that, wanted to give 3 quick reminders. So the first one is please do consider calling in for a 30-minute coaching session on Wednesday, March 1st. The phone number is there. Monica, I think, is going to put it in the chat also. And second, please register and attend our next webinar in 2 weeks on Wednesday, March 8th. That one is on creating a safe and dementia-friendly household. So more of that environmental stuff, and also how to prevent wandering. And third, if you haven't yet, take the survey. Monica is going to put the link for that in the chat, or when we send you the workbook, there'll be a survey in there and you can send it back in the mail if that is your preference. So I'm going to pass it over to Monica now for questions.
Thank you so much, Amy and Stacy. Good information, and it's such good reminders about behaviors versus distressed reactions, because I think so much of the time people think, oh, they're just doing this on purpose, and really it's not. You really do have to figure out what's causing them to react in the way that they are. So thank you for that information. I'm struggling a little bit in the chat with trying to find everyone so that I can share the link. I will continue to try to do that. As I look through the chat, I'm not seeing any, whoops, I think I just lost, oh, hold on a second here, there you are. I'm not seeing any new questions from the group, but I do have a couple of things that we wanted to ask you all about. And so I would just ask Amy if she could help us to think of a few ways to pre-plan to address the needs to avoid a distressed response. So if we're getting ready for a bath, what kinds of things could we potentially do to avoid that distressed reaction from happening in the first place?
So in terms of getting ready for a bath, so what you might want to consider doing is, like we said, warming up the bathroom ahead of time, you know, having the hot water running in there, turning on the fan, getting it all warmed up and cozy. Some people actually do well if you're actually not focused on the task at all. So, you know, we've some caregivers have very good luck with bathing someone while they're entirely talking about something else the entire time. So the focus is not on bathing, but it's about when this woman used to be a hairstylist when she was 40 years old. So distract from what's happening. Let's see, what other suggestions do you guys have?
I wanted to ask you too, and the example that you shared with us, the gentleman, the wife that just said, go into the room and get dressed. What things could she have done differently to prepare and make that situation go a little smoother?
Sure. She definitely, I mean, if he is having trouble finding the room where his bedroom is, she could say, come with me, and just kind of guide him back there. Some families do really well with actually putting some labels on the drawers or in the closet. So, you know, pants here, pajamas here, underwear here, which can enable him to be independent with finding it and reduce his frustration because he's not looking in so many of the wrong places. I've seen, you know, I've seen many a distress reaction occur because he goes back to, you know, put on his clothes because maybe they're going to church, and he comes out in shorts and a t-shirt, and his wife says, you know, you can't wear that. We're going to church.
You told me to get dressed.
I know. Yeah, he got dressed. He did the best that he could with what he had. So, you know, in that, she may want to either consider either like laying out his clothes in the location that he goes to find them. Same thing with like season appropriate clothes. You know, if you don't want him wearing shorts and flip-flops in December, you got to make the shorts and flip-flops go away. And so to give him a choice to be able to pick between multiple correct options rather than setting them up for failure.
Thanks, Amy. So we do actually have a question now in the chat. We have a person who is asking, how does a person become diagnosed with dementia? And Stacy, maybe either one of you, but Stacy, could you address that?
Sure. I would say the first line would be to see their primary care doctor if they've, you know, been seeing a doctor. If not, they could, you know, try and make an appointment at a clinic. Typically, they might do an MRI to look at their brain. They might also want to rule out stroke, some other issues if they're having it. There are other ways that, you know, they will do like an assessment on their dementia symptoms, and then, you know, they can kind of see how their memory loss is progressing. And it's always a good idea to have sort of a baseline measure of that, so that you know, if you are having trouble with your memory, it's good to start out that way and then progress from there. Then you have, at least you know where you start and how things are going. Amy, maybe you have something to add to that.
Yeah, so dementia diagnosis usually starts by the doctor trying to rule out other things that can cause memory loss but can be treatable. And there actually is a kind of a long list of other things that look like dementia but can actually be treated, which is good news. And so, you know, there's the rule out process, and there's also, you know, like Stacy said, cognitive testing that is done on the person with the disease. But the diagnosis, it also comes by the doctor talking with the family caregivers about the observed symptoms that they've seen, because, you know, pretty often the person with dementia doesn't have a lot of insight into the changes that they've had. And there's extensive testing that can be done if there's a need to figure out what kind of dementia it is. And, you know, that can be good sometimes, but, you know, that kind of extensive testing is usually takes like around 3 hours to be able to complete that. And so, you know, if you know that your family member with dementia probably can't sit through 3 hours of testing, then that would be a conversation that you would want to have with the doctor or neurologist, so that it doesn't become kind of a frustrating experience for everyone.
So Amy and Stacy, you all talked a little bit about not throwing a pill on what we would say are these behaviors or just distressed reactions. And I think very often we hear of medications that even natural kind of remedies that may help to calm people down or calm someone down. And it may work for someone like me that's not necessarily living with dementia. What are some reasons to avoid some of those calming medications for a person that's living with dementia?
Okay.
Uh,
Oh, you want to go? Go ahead.
No, I mean, I guess the first reason would be kind of the dangerous side effects that they can have. I mean, there are medications, not even calming medications, but things like Benadryl that are very common over-the-counter medications that are okay for a lot of people, but become very dangerous, particularly for the population of people that has dementia. So side effects is a piece of it, you know, whether it be side effects on their level of confusion or side effects on their balance or dizziness. You know, although a fall isn't necessarily directly related to a brain disease, it sure does tend to progress a person's dementia a lot faster after that happens.
Yeah.
Thank you. So if we were creating a dementia-friendly environment at home, you talked specifically about the clothing and trying to have things ready for your loved one and when they're getting dressed. But are there other things that you might consider in the environment to ensure that we're prepared for that potential distressed reaction? Stacy, could you talk a little bit about that?
Sure. Some of the things, you know, is a lot in pre-planning, like some of the examples that Amy gave of triggers that people might have, loud noises. You know your family member better than anybody else, and you know what's comforting to them and what's most calming for them. And you can also witness a lot of these things that might be triggers for them. So, you know, not that you don't want, you know, family to visit, or you know, you don't want them to, you know, interact with people. You don't want to shut them away from, you know, their loved ones, but you might not want to have like a cousin reunion at your house. You know, you might want to just say, okay, you know, let's have the 2 grandkids over and make it for a limited period of time, you know, and then talk about it with them ahead of time and say, you know, sometimes grandpa gets a little upset about things, and you know, if I kind of give you the signal, then maybe that's a good time for you to leave. You know, just kind of preparing people ahead of time and preparing the atmosphere around them, and you know, being aware of what their comfort mechanisms are so that you can, you know, help them get to those kind of places if they do start to feel, you know, anxious or confused or upset about those kinds of, you know, environmental things.
That's really good advice, I think, for people that are not working or living with someone with dementia, and then they come into that environment and didn't know what to expect. I think giving them that prep in advance to say,
Yeah.
if she says this, don't react this way. It's okay.
Right.
So that's
Yeah, and
really helpful.
I
Yeah.
think sometimes families are very afraid, you know, because they don't want to set them off, but they don't know how to handle that. So if you can, you know, prepare them the best you can by, you know, what you've learned about your family member before they come, I think that kind of eases everybody's nerves.
Thank you.
Sure.
So at another question in the chat, what is the age range that dementia is most likely to occur?
Mm.
So dementia is a disease that the risk of it and the incidence of it increases with increased age. So I think the statistics for people that are 65 years and older are somewhere around 1 in 10, but by the time a person is in their, is it 80s or 90? I think 80s.
85.
By the time they're 85, it's somewhere between 1 in 2 or 1 in 3.
Yeah.
Yeah.
Okay.
But you know, this is not to say that it doesn't happen to younger people also. I mean, early onset Alzheimer's disease, that is typically, you know, it happens to people who are diagnosed when they're less than 65 years old.
Mhm.
I don't know how old Bruce Willis is, but that was just recently that he was diagnosed with early onset.
Yeah.
Yes.
So we're heading very close to the end of our time, and I want to thank both of you for sharing this information. And I think the encouraging thing, and I know that's part of what Dementia 360's goal is to help people understand that they are not by themselves,
Right.
that there is so much support out there. So when you hear these stories, it helps you realize that you're not in this alone. So thank you both for that. I want to thank everybody who tuned in to our session, and just wanted to remind you that the survey link has been posted. You will also get that information, and feel free, and we want to encourage you to participate with the free dementia caregiver coaching sessions, March the 1st from 7 a.m. to 5 p.m. And the number is posted in the chat. And so at this time, I'm going to turn this session back over to Joanne Boyd, and want to let her close us out. So thank you for allowing me to join you all this evening.
Thank you.
Joanne.
Thank you, Monica, and our panelists, Amy and Stacy. Another great education series. They have been very informative all along, and I encourage people to join in on the last 2 sessions in March, and to take advantage of the coaching session next Wednesday. So on behalf of Gateway Medical Society and Pittsburgh Black Nurses in Action, thank you to our audience for taking time to join in this evening. And I hope you found this as informative as I did, and we hope to see you back again next session.
Thank you.